ready.
Okay. All right. So, good afternoon and welcome to the Family Communication Exchange. This is our fourth episode, and today we're going to talk about dentistry and COVID before and after in the dentist office. And so we have the pleasure of having Rochelle Jackson, Dr. Rochelle, as our guest, but um, we're going to allow her to introduce herself. I'm going to ask her a series of questions that were submitted to me, and then we'll open up for discussions. Depends on how many people join. We either use the chat or we'll just speak out, raise your hand, and that kind of thing. So, Jessica, go ahead. I want to say thank you, first of all, for joining and taking on this event and sharing with us. So go ahead and introduce yourself, and then I'll start with questions.
Alrighty, good evening, everybody. I am Dr. Jessica Rochelle Jackson. It gets confusing because family calls me Jessica. I'm still little Jessica to them. But when I went to college, I actually started going by my middle name, which is Rochelle. So whatever, Jessica Rochelle is fine. I moved to Nashville in 2006 to attend undergrad at Tennessee State University, and then I went on to get my master's in health sciences at Meharry Medical College, and then I graduated in 2018 from Meharry Medical College with my doctorate of dental surgery degree. So, and then like a month after that, I got my license. So I've been practicing for right at 2 years. So I'm a general dentist living in Charlotte, North Carolina, but working in Gastonia, North Carolina, which is like 30 minutes away. I'm currently employed by Contegra Health, and we are a public health facility. So I get to serve the underserved and treat people who don't have insurance or have little insurance or have Medicaid. So I've been doing that it'll be 1 year on July 22nd. So my anniversary is coming up very soon. 1 year of having my first big girl job, and I love it. I get to help people who can't help themselves. I always say that I get to serve people who look like me, and they love it. They walk in the room, and I've had people when they see me walking, they say yes. So they get so excited when they see somebody who looks like them too. So I love it, and I'll be doing this until I can't.
All right. So thank you again, Jessica. Dr. Rochelle, thank you so much for joining us and sharing with us. So I'll start with the questions. And so we want to know, basically, our first question, is it safe to go and visit the dentist's office now? Is it safe because of COVID?
So for the most part, yes, it is safe. I want to say the CDC released a guideline or a chart of least safe to most safe places. One of the least safe places to be right now is in a crowded bar. Everybody's really close together, not really wearing masks. Dentistry falls at number 5, so it's a 1 to 10 scale, and the dental office falls at a number 5, so we're literally in the middle. So it's relatively safe. There are different precautions that we're taking to make sure that everyone is safe. So yeah, for the most part, it's safe. Go to the dentist.
Okay, so get out there and go to your next appointment. So my next question, what should we expect during our next visit to the dentist?
So one of the first things that you'll expect is a lot of offices don't have the lobby open, or the waiting room is closed. So when in my particular office, you pull up in your car and we have a big sign that says, hey, the new lobby is now your car. So once you pull up, you either text us or call us to say that you're there, and then we proceed from there. So once the doctor's ready to see you, then you'll come in, have your temperature taken at the door. Before you even come in the door, and when the appointment is confirmed, we ask you a series of questions saying, have you or anyone else that you know been exposed to someone with COVID? Are you running a temperature? Do you have a cough? We have a list of 5 to 6 questions that we ask you when we're even making the appointment. So that's first. You wait in your car, you come in, you have your temperature taken, and then from that point, most times paperwork is all done online beforehand. So before this started, you would come in, you would fill out all your paperwork, and then be seen to the back. Now we're actually emailing you a link that has all of that information to fill out. So when you come in, you say, hey, I'm here, and you're escorted almost immediately straight to the back. There's no more waiting in the waiting area. So those are just some of the things that we're doing to try to prevent people congregating. Another thing that once we make the appointment, we ask that you bring a mask to be seen. And most of the times we won't see you unless you have a mask or some sort of face covering to come in. Yep. So
Okay.
once you get in the
So
back,
it sounds.
yeah. Mm-hmm.
I'm sorry. Go ahead.
Yeah, once you get in the back and get in the chair, then you're able to take the mask off. But while you're out in common areas, everyone is required to wear a mask.
Okay. So I was going to say, it sounds like you won't supply personal masks to people. If they don't bring their own, then they can't have any of yours.
Well,
right?
it depends. At first we were doing that. We would suggest that people bring masks, but then they would show up and say, "Oh, I forgot my mask. Can I be seen?" And they just wanted a free mask, and we started running out. So we had to kind of put a stop on that. As you try to be nice to people, but some people just take advantage of that. So we do ask that you bring one, but if you don't have one, then we will supply you with one.
Okay, very good. So then what steps would your office take to prevent the transmission of diseases? So what steps do you take now to prevent the transmission of diseases?
So one of the things is what I was just speaking about, limiting the amount of congregation that we have in the waiting room. When we schedule the appointment, we let you know that only the person who's actually getting the dental work done is allowed in the back. The only exceptions are if a parent has a small child, and like by small I mean like under 5 or so, they are allowed back. Or if it's an elderly person who needs assistance, then their caregiver can come back. But other than that, there's only one person allowed in the back, just to prevent so many bodies being around. We have the mask wearing. The dental office has always been a pretty sterile environment because of what we do, but everything has been increases 2, if not 5-fold. So after every person walks in the building, we have a person at the front who's actually appointed. They're called an environmental protection person, and they're wiping down doors, they're wiping down chairs, they're wiping down common areas, pens, everything. So everything gets wiped down multiple times a day to prevent the spread of things that people touch. Another thing that we're doing is we have what we call these HEPA filters in the room, and they look like a big fan. So the filters actually oscillate or circulate air in the room. So instead of like the old, I guess, stale air, it's circulating air every so often. So we have to turn that on 15 minutes before the patient gets in the room, and keep it on all day and leave it on at least 15 minutes after the last patient leaves. So it's just constant circulation of air so that those aerosols and those respiratory droplets aren't being transmitted. So that's another thing. We've always had the protecting over the lights, over the chairs, and that, of course, has just been implemented more, just making sure that everything is covered and that people aren't touching as much stuff, and what they do touch, we're wiping down.
Okay. So it does sound like you guys are protecting your office and keeping or reducing the spread of diseases in your office. But from a patient perspective, how are you preventing the transmission of that disease to your patients?
So one of the things that we were doing, and it's a blessing that no dentists that I personally know have caught it, because we do work in such close proximity with patients. We're pretty intimate with the patient. So besides that, the HEPA filter, we actually have implemented, and I wish I brought a picture, but we're requiring that any aerosol producing procedure, which means like a filling or a surgical extraction, anything that has to use the drill, as people call it, we're using a rubber dam, which is a dental piece of rubber that we put over the tooth to isolate just that tooth and to prevent the spread of the drill, the handpiece, producing out all that water in those droplets. So we're doing that. We also have extra suction. So instead of just the one suction that you see, now we're having two suctions to prevent, like, we're super close on that one tooth so that water isn't being spread all over the room. We also have, which I haven't used them yet, but they have these little cups, these little filter cone cups that the patient can actually hold to try to catch any extra water. So we don't want any water anywhere. So we're trying to prevent that spread. Another thing that we're doing is dentists have always, of course, well, not always. We've always worn gloves, but now our PPE or personal protective equipment has increased tremendously. And I actually provided a picture to show you guys of how I have to go dressed in. I get suited and booted, as I call it, before I go into surgery. So here we have I have on, this was actually today, I have on a hairnet. Look like I'm about to go bake some food or something, bake some cookies. I have a hairnet on. I have a face mask along with eyewear. Those are my personal glasses, but we also have goggles that we wear. And if you can look closely, I have on two masks. I have on one mask, which I'll show you, which is it's called a level 1 mask. It's pretty thin. It prevents from, the higher level you go, the more protection you have. So this is a level 1 on the inside. This is what people wear just out and about. And on the outside, I actually have an N95 respirator, which those are level 3s and 4. So I have one here. So once you put these on, I can't barely breathe, but I can't smell anything. So that prevents those particles from coming inside of me. So it's not only protecting me, but it's protecting the patient of anything coming out, towards them. And here's a little area for ventilation. But I have on two masks. And then next picture. And besides my gown, which is a disposable gown, I have to take that off every time after every procedure. I also have to wear shoe coverings.
Do you see it?
Mm-mm.
No, that's it. Okay, let me go back then. Try this one more time. Okay,
there we go. So yeah, I actually have on shoe coverings as well. So literally from head to toe, I'm covered. One other thing that we do is I'm no longer allowed to wear my scrubs on the outside of the building. So every day I leave for work, I have a red backpack full of my scrubs, but I go to work in street clothes. So I go to work in my clothes. I change in the office into my scrubs. I only wear my scrubs in the office. Before every aerosol producing procedure or like the fillings, like I was saying, I go like this. And before I leave the room, I have to take off everything except for that level 1 mask, that thin layered mask. All of that stays in the room. Then we have to leave the room for at least 15 minutes. Then the assistant isn't even allowed to go in there and clean until 15 minutes after the procedure's over, just so that HEPA filter can circulate that air out and make sure that the aerosols have been dissipated, that they're gone. Also, once a procedure like a fill-in or a surgical extraction starts, we're no longer allowed to leave the room. A lot of times we'll say, oh, I forgot such and such, let me run and do that. That's no more. So that makes everybody stay on their P's and Q's, because once you're in that room, you're locked in. Nobody's allowed in or out. So you're closed until everything's done, and then 15 minutes after, they go in and they clean it. So things like that, just that extra protective, those extra protective layers, making sure that there are no aerosols floating in the air, and making sure that the patient doesn't have any symptoms is what we do to prevent the spread.
Wow, so that's interesting, because I'm a connoisseur of the dentist's office, but I like how they'll start a procedure on you and then they'll leave and go care for another patient. Are you saying that they stay with you the entire time throughout your whole treatment?
If it's an aerosol producing procedure, then I'm not allowed to leave. Now, if I'm just going in and doing a check for a hygienist, or if I'm doing a denture adjustment, well, even denture adjustments, anything where you use the drill, you can't leave, because that drill produces aerosols. So even with the hygienist now, I don't know if some of you guys have had what we call a deep cleaning, and they use that it's called a Cavitron. It's like an electronic cleaner where it goes underneath your gums and cleans under your gums. Even hygienists have to limit the amount of deep cleanings that they do because it produces all that water, produces all those aerosols. So for a while, we were only brushing people's teeth with toothbrushes. We couldn't even use, when people get a cleaning, they think of the cleaning as that last part where they polish with the cup and then they go. We can't do that right now because that's an aerosol producing procedure, and it's just hard to prevent the spread. So hygienists are having to now get the instruments and scale or to clean underneath the gums, and after that they just get a toothbrush and just kind of brush it real well and floss it because we just have to limit what all can be done. So yeah, from now on, I go and I anesthetize the patient and I sit. I'm with them. We're chilling till they're numb, till it's time to work, and then once I'm done, I derobe, and then I can leave and go to the next one. So it's created not issues, but just trying to get creative with scheduling, making sure that I don't have two fillings can't be next to each other because I can't be in two places at one time. So just making sure scheduling is right, making sure my hygienist doesn't need me while I'm in there, because once I'm in there, we're not opening the door because I just don't want to put myself or my patients at risk. You don't want anybody walking down a hallway and then that air is, hitting them and causing something. So we're not leaving.
Very interesting. So I believe you already answered this question, but it was centered around the space of protecting or giving protective gear to the patients. So I think we've already kind of addressed that. So we'll move on to the next question. So what type of treatments, and you may have covered this already as well, what type of treatments or procedures are approved to perform during COVID? And I think you touched on that, but could you just give us like a bullet list of things that could be done during this COVID season?
So honestly, everybody's office is different. The CDC has guidelines. The American Dental Association has guidelines, but they're so nervous about, I don't know, I guess they're worried about being politically correct. They can't say you have to do this or you cannot do this. So they give us guidelines or suggestions. So up until June 1st, my company was not doing anything aerosol producing. We were only doing exams or emergency visits, which I'll explain later what an emergency visit is. But we weren't doing any fillings. We weren't doing any denture adjustments. If you can wait, we made you wait. It was a long period of, here's an antibiotic, go home and pray. And I hated that because I don't like just pushing antibiotics because your body builds a resistance. So when later on in life, if you do get a bad bug, then it might not fight off as well. So I've never been the type of dentist to just kind of hush somebody up and give them antibiotics or pain pills, because also pain pills, I'm not going to jail for nobody. So that's another thing. But anyway, back to the question. We were so right now we're basically able to do everything except for, like I said, the hygienists have to limit the amount of cavitrons or deep cleanings that they do. But I did a filling today. I did an extraction today. I did a surgical extraction today. Checkups. So right now we're almost back to normal. I would say about 85% or so normal. We just have to tweak how we do it. We have to give longer time. Our appointments are a little longer just because we have to have that filter, that air filter, do everything, and we aren't able to see as many patients or maybe do as many fillings. Maybe before I could do 4 fillings in an appointment, but now I can only maybe do 2 just because I have to give the room time enough to circulate. But you still want to see a decent amount of patients in a day. So, but yeah, I think I answered the question. For the most part, we're doing everything.
Yeah, I think so. Thank you for that. So it kind of just segued to our next question is, what type of procedures are considered an emergency during the pandemic?
So an emergency is, I used to say emergency is pain, but everybody has a different tolerance of pain. Pain is very subjective. So you can describe something to me and say, hey, I'm in so much pain, but I look at the x-ray and say, you probably aren't, you're probably okay. So pain is swelling. I've seen patients who, because at one point we were doing what we call teledentistry, and we'll get into that, but I saw patients who would send me pictures and have big golf ball size cheeks and swelling. And one lady called me and said, "Hey, I don't know if this is an emergency or not, but my son's eye is swollen shut and he has a fever of 104." That's an emergency. Go to the hospital. I can't even see you at that point, because at that point the infection has spread so much and it's caused cellulitis. It could cause death. So go to the hospital. But an emergency typically is fever, swelling, um, abscess. If you see pus coming out, all those emergencies. Unfortunately, pain is not necessarily an emergency, because I can't tell you that your pain is enough to get something done. It may just be, okay, it's pain because it's neglect. And that's another thing we ran into a lot. People hadn't been to the dentist in 10 years, but all of a sudden, "Hey, I'm in pain. You need to fix me right now." Well, that's not how that works. It's your emergency isn't necessarily my emergency. And I hate to have to, put it that way, but that's not fair for you to, neglect yourself for so many years and then you expect me to be a miracle worker. That's not how it works. So, unfortunately. So, yeah, pain is fever, swelling, any type of exudate or pus, blood. If it changes different colors, I've seen a lot of stuff. So, yeah, a chipped tooth, and even a chipped tooth, a chipped front tooth, that's not an emergency. That's your emergency, but that's not an emergency. At that point it's cosmetic. It sucks, but it's not an emergency.
For sure, for sure. So we're going to just transition a little bit and let's talk about water safety. So you have a water line, obviously, and so some people are concerned with even just the water itself. So how safe is it to rinse? And you mentioned that a little bit, but let's just talk a little bit about the water line safety during COVID.
So water is a very big part in what we do. We can't do dentistry without water. So our water has to be tested quite often. Some offices are bi-weekly, some are bi-monthly, some are monthly, but water has to be tested very frequently. So we go in and we get every single place where water comes out, we put it in these little vials and we send it to a company. They test it, and we have to have so many colonies or less of bacteria for our water to be safe. So that has to be done on a constant basis. So it's a company that we send out that's not even in the same state as us, and they get back and say, "Okay, your water was good," which we've always tested well. But if it wasn't, then we would have to come and have someone clean out the water, and we would have to shut down the office. Without water, we can't run. So water is definitely safe because it has to be. So it's tested quite often, and there's nothing in there that should harm you. Yeah.
Very good. So with the coronavirus, we've heard just every day, almost every commercial, wash your hands, use hand sanitizer, that kind of thing. What is the recommendation for your mouth? Is there something that you recommend that you could use for like a rinse or something of that nature?
So every appointment that we have, this is another way we're preventing the spread or to keep our patients safe. Every patient who comes in, we make them rinse with a 1-to-1 ratio of hydrogen peroxide and mouthwash or Listerine. So we take, and I don't think we necessarily measure it out, but we take half Listerine, half peroxide, make them swish with that for 30 seconds, and studies have shown that produces the bacterial load that's in a patient's mouth and just makes it more sterile. So we do that before any procedure. Before I even walk in, the patient should be rinsed because, like I said, I have that intimate contact with them. And every procedure isn't an aerosol producing procedure. Every procedure isn't a filling. Sometimes I'm just going in and doing an exam. So I don't want your cough to gravitate towards me, which, anything can happen, but it helps to reduce that bacterial load. So if anything, I would suggest that, because peroxide we know kills germs, and then the Listerine or the Scope or whatever brand, it doesn't matter the brand, that has properties in it that reduce that bacterial load and make it more safe for you.
Okay, very good information. So we know we're transitioning to the new reality And we mentioned, about telemedicine. So is there teledentry, dentistry coming along? How do you have any information on that?
We do. We do teledentistry calls. We did that a lot because we shut down. Well, shut down. We went to only emergency care in mid March. So from mid March until June 1st, we were doing emergencies only or teledentistry. And with teledentistry, excuse me, the patient calls in. We ask them that same list of questions, and we say, hey, we can't have you come in just yet, but why don't you send us a picture and show us what's going on? So they tell us their symptoms, and then they'll send us a picture of the area or the tooth that's bothering them. A lot of times, so then they would send that picture in to the front desk. I would then get that picture and review their file. I would call up the patient and say, hey, okay, I'm looking at this picture with you. Let's talk it out. What's going on. A lot of times I was able to look at the picture and say, oh, okay, well, that's just a chip, so that's not an emergency. Or, hey, mom, that's a baby tooth. Little Susie's going to be okay. That's not an emergency. And it saved them, number one, a trip in the office, so that's less people in the office and less people congregating around and possibly spreading disease. And it saves them some money because the tele-dentistry visit isn't as much as a regular exam. And it just saves everybody time because you come in. It's so many times. It happens a lot with kids. Parents come in. Oh my God, his tooth is loose. What's wrong? So then I look and say, well, mom, it's a baby tooth. So it's okay. Just wiggle it out. I can wiggle it out, but I'm gonna charge you $100. So I can wiggle it out, or you can wiggle it out. So it saves everybody in the long run. Or I can look and say, oh, that's an emergency. Come in. I need to see you now. Because a lot of times people just don't know. They may think something is not as serious as it is, or more serious than it really is. So it just kind of cuts that out, and it gives me a chance to look at the patient and kind of assess it before they actually occupy space in the office. So we're still doing teledentistry calls to this day. And it just helps with that. If I look at it and I say, okay, yeah, that's an emergency, then we go ahead and schedule them an in-face visit. Or I can say, okay, this is really okay. Here's what you need to do from there. I can kind of triage it and treat it from there. So I think it's still a good thing because it just helps cut down the amount of people in the office who don't necessarily need to be there.
Interesting. Very good. So then, as people are waiting, because maybe it's not an emergency after your evaluation, do you offer or suggest anything that they can go to get over the counter? So let's just say that maybe a filling cap or something, came loose or loosened or whatever the case may be. Are there home remedies or over the counter things that you would recommend them do while they wait for the next appointment or during this COVID season?
So that's still a case by case basis. I still say call the office and at least see what's going on, because I've had patients who come in and say, hey doc, my crown fell out and I super glued it back. Is that okay? No, that's not okay. That's not okay. So now you've almost poisoned yourself, and now we have this huge mess to clean up. So some of these remedies, I'm like, don't be a Google doctor. Don't do that. I would still call in and see and get an assessment of what's going on. As far as pain, I always recommend over-the-counter Tylenol and ibuprofen. Those are your best friends, and taking those two together really helps because one is an anti-inflammatory and one is a fever reducer, a pain reducer. So you have one that's, once they work together, they have synergistic properties. So once they work together, then they really take care of the job. So even when I have patients who have hard extractions, I'm not going to give you a hydrocodone. I'm going to tell you to go and get some Tylenol and ibuprofen because number one, I don't want to go to jail, and number two, those two work together very well. So but I will say that if a filling falls out and you can't get to the office before then, they do sell temporary filling material at Walmart. So that's fine to stick up in there. Sometimes toothpaste kind of holds it. Orajel still works. Orajel is good. But don't stick... Call a dentist. Don't just find anything to stick in there. People are very, very creative. I've seen paper clips. People are very creative. But just be very careful what you place in your mouth. But people get real
So
creative. You
was
would be
that
surprised.
the paper clips was for braces? What?
That and just trying to hold stuff
Oh my
together, trying
gosh.
to.
No, not a paperclip.
I've seen so
No,
many
no,
things.
no, no.
Y'all would be
Oh
so.
my
The
goodness,
super
that's
glue is what really
funny.
got me. I was not happy that day. You can't put super. You can't do that. You can't do that. So yeah, people get very creative, but
Wow, that was incredible.
just be careful. Be careful.
All right, that was great. That's very very interesting. So yeah, so that was the questions that I had. So I guess we're gonna open up now. Unless there's something, Jessica, you want to just kind of say, I'm gonna open it up for our guests to ask questions.
Oh yeah, I was gonna
So
say,
yes.
wear your mask. Like I know some states are mandating it now. North Carolina has mandated it. Kentucky is on the way. I'm not sure what y'all doing in Texas, cousin Pam. I don't know what the governor is up to down there, but we don't know.
Nothing.
But
We don't know.
wear your mask, and I brought some masks to show y'all. So like I said, this is a level 1 mask. It prevents it across just simple what am I trying to say? Simple microorganisms. But I see people all the time wearing their mask like this. That defeats the purpose. It's supposed to cover your nose and your mouth. It shouldn't be under here. I've just seen them so many ways. So the proper way to wear your mask is you loop it around your ears, and then make sure it covers both, and then you pinch it here, and then now it's covered. All this is covered, my whole mouth, my nose, and it can sit under your eyes, how like that. So now I'm good. I'm covered. Will it prevent everything? No, but studies have shown that wearing a mask is going to prevent at least 10 times more the spread than not wearing a mask. So we've talked before in discussions how people in the grocery stores with gloves and masks on. I'm not too fond of the gloves, but I'd rather you have on something than nothing. So no matter where you are, gas station, grocery store, anywhere, because it's still there. Just because these places are opening and people think that, okay, well, the state is open, so corona just disappeared. That's not how it works. It's a virus. It's still here. I also see a lot of people with the little cloth masks. They're decorative, and that's fine. These aren't going to prevent as much as something like this or this was the big heavy duty guy. But if you have to wear this, that's fine. I'd rather you wear, like I said, something than nothing. Same concept. I made this last night. It says smile. So still again here, nose, mouth. Every mask is made different, and they have different sizes. So if it's too small and it doesn't fit under your nose like this, then it's not for you. Go up a size, because it's supposed to cover at least all of that. So I wanted to make that disclaimer. Wear a mask no matter where.
Good, very good. So, to my guests, do you have questions? We have a smaller group, so we can ask questions that we may have. Just speak up and ask your question.
Hello, hey Jessica. Dr. Rochelle. Let me pick up where the masks were first. Okay, so if you have a mask on, because mine are like blue and then they're white, which side should be on the outside?
So that's a very good question, because I was actually recently misinformed. I thought that if you had something, then the mask should face one way. If you don't have something, it should face another way. That's not true. The colored side goes out. The color, and I don't have a colored mask with me, but the color is always facing out, because it has a special filter on the outside that actually filters out those microorganisms coming toward you. It's a special material that they do on the outside. So whatever color always faces out towards the public, and just think about, hey, I want people to see my color versus the white. So
Right.
that's how I remember it. So yeah, color always out. That's a good question.
Okay. And then, okay, so one mask would help, you said it's a small percentage because, it's so thin. Should you put on two?
You don't have to. I think social distancing is still very important. So this is still gonna cut down on those microorganisms coming towards you because number one, you're staying 6 feet away from people and you have this on. So it's not necessary. I would say that like for me, I guess since I'm so close to people and I do have those aerosols spraying, then this helps because once I put this on, like I said, I can barely breathe sometimes, so I know nothing's getting in. But no, one mask should be fine. I'd rather have one mask on properly than two masks that's not doing nothing. So yeah, one is fine.
Okay.
One is fine.
And so you had on all that gear, and everything. So if I'm going to the dentist office, what should I wear that's going to help me? What kind of things should I avoid, like a jogging suit, the silky kind or whatever? What should I avoid having on?
That's a good question. I think you can pretty much wear anything because, like I said, once we have those filters on. Once I have all that on, that's because I'm protecting myself because I'm literally just so close to you. I'm hovering over you. So with you, you're just kind of laying back there, and my system is catching all the water. I have that filter going. I have that rubber dam on. So there really shouldn't be many things going out towards you, depending on the procedure. I did do a surgical extraction on Monday where it got really bloody. So I mean, we had the bib on the patient that got really messed up. So if you want to wear long pants, that's fine. But you as the patient should be pretty safe because I have all of that to protect me from you and it to protect you from me. So you should be fine.
Okay. All right. So I have a dental appointment coming up. I'm going to get my teeth cleaned.
Okay.
And so what instruments should the dentist not be using? I know you said nothing that like watery or whatever. You know how they have that water thing, but could they use that suction thing? Should they be using that?
Yeah, she can use that. Like I said, right now my office isn't. We're only using It's called a Cavitron, that little machine. We're only using that 2 times a day, and then even with that, the door is closed. The hygienist door is closed, and when she leaves out, 15 minutes of circulation. So it's okay if they're using that, but it's kind of hard to say because, like I said, these are guidelines. I think my office is going above and beyond, but I'd rather them do that than to not do anything, and then we have an exposure and they trace it back to us, then we're gonna get shut down. So I would just ask your dentist, hey, what precautions or what procedures do y'all have in place to protect me? Even with the hygienist in my office, she has this plexiglass. You said plexiglass that everybody's using at different facilities. She has a plexiglass that attaches to her light, and that actually goes down over the patient's face. So it's like a shield. That's another thing I forgot to mention. It's like a shield of plexiglass because she doesn't wear all that we wear. So that protects you from her. So all that splatter and water gets on the glass versus getting on her. So they can use pretty much any instrument, but I would just ask, what precautions are y'all taking to make sure that we're safe?
Okay, that's a great question. I think I'm gonna call them in the morning. And lastly, okay, so say I do have COVID and I have this emergency, like you say, it's a swelling or pain or whatever, abscess or whatever. Do y'all see patients that have COVID?
We have, but it's been very, very few. Very few, just because depending on the state of the emergency, because the dental emergency, that there are certain dental emergencies that can be managed in a dental office, and some dental emergencies have to go straight to the emergency room because there's an oral surgeon there that can take care of that. I'm a general dentist, so I don't do all that an oral surgeon does. That's why they go to school 6 extra years after me to get extra training. So a lot of times they'll have an oral surgeon on call that if you come in and your eyes swollen shut, I'm not going to touch you because I don't want to, put yourself. One of the rules is we have to do no harm or do more good than harm. So I'm not going to cause harm to you knowing that I can't treat you. So I'm going to send you to the ER. So if it's an emergency like that, then you're already in the best place anyway. But Yeah, I guess it just depends. We have seen, I can think of one person, and we didn't know till afterwards, but luckily,
Mm-hmm.
but just like how we don't know what any of our patients have, we have a lot of patients who come in who are HIV positive, and you don't know. You treat everybody exactly the same. I wear all of that no matter what the patient is, because there have been plenty of times where you go in and you do something and later on you find out, oh, they had AIDS. Okay, well, that's fine. I was covered, but I'm covered with them just like I'm covered with anybody else. So it's the same. Not gonna treat anybody differently, but if we know beforehand that they do have COVID, then we're gonna do everything we can do to prevent them from coming to the office, and not to be rude or anything, but just to protect them. So we're
Mm-hmm.
gonna that may
Right.
be a case where, okay, I do give you antibiotic until you're okay. I do give you some pain medication, or I do try to talk to you over the phone to make sure that can be treated before you come in the office.
Mm-hmm.
Okay.
Excellent.
Okay. That's good. That is good. And don't
Yeah.
forget, you're also covered by the blood of Jesus. How about that?
Amen. Amen.
Amen.
Always.
Amen on that. Seriously.
Yeah,
Seriously.
so I think that's
Amen.
it. I think you really, really covered a lot. And, right now my concern is because when my dentist called me and said, because I made this appointment months ago,
Right.
and said that, and I said, y'all open, and so it's not, I really don't need to go, but I want to go because, just to be consistent and everything. So I was just wondering, so would you go if it was just a cleaning and, I mean, nothing's wrong, I'm not having any pain, everything is good, it's just my yearly cleaning, would you go?
Um, if it was me, would I be nervous? You probably. Would I ask a lot of questions? Yes, but I ask a lot of questions anyway with anything. So I would be the one with the mask and, okay, don't touch me, don't. But I've I feel like if you can go get a pedicure, you can go get your teeth clean. That's how I feel. So don't pick and choose. You can't
Yeah.
serve two masters. So you gotta. I feel like if you can do those things, then you can go get your teeth clean, because you want to stay on that. You want to stay on that schedule. Yes, nothing's hurting, but all of dentistry now is like preventative. Why cause some harm if you don't have to? So just stay on top of it
Right.
and try to stay as close to your 6 months as possible, because right now we are off, we are behind. We went 3 months without seeing anybody, without seeing any cleaning. So it is a lot of catching up to do, and some people have blatantly said, I'm not coming in, and that's fine. You patient autonomy, you have a choice to come in or to not, but we're here if you do want to come in, and we're here if you do want some advice. Still brush your teeth though every day, 2 times a day. Floss if you do decide not to. That's definitely your decision, but I would go just because. Yeah, I know me.
Okay.
That's true.
Okay. Thank you, doctor.
No problem.
Yeah. So on the phone, do we have someone with a question?
I have a question.
Yes,
Okay.
Queen.
I want to know who your mama, how you get to be so cute.
My mom is the queen, Queen Gina.
Oh, okay.
That's how it happened.
Any additional questions on the phone?
Really, mama? Really?
I couldn't help it. I couldn't
Other
help it.
questions?
I have
Yeah.
a question. Well, I'm sorry, you all. I had a call I had to take. Oh, I
You
don't know
have
if you-
questions?
Yes, I have one question. Well,
Okay.
just so I guess I have an appointment on around the 21st, and it's just for a cleaning. And I guess I just wanted to be sure that, they were masking up, because I didn't want them breathing in my mouth, if you will.
Mm-hmm.
So, based on what I saw earlier, and how you were suited up, if you will, and the precautions you were taking, I know that they're doing something similar, to, waiting in the car and not being within the environment until it's your time. So, and I'm pretty confident. I'm one of those, if I see something that doesn't seem right to me, I'll question them about it. And say, hey, you think maybe you should? Because I had this, just totally aside from COVID, I had a thyroid issue years ago, and I did some study and some research and everything, and found that maybe through part of the reason could have been due to not having the thyroid guard being used when you get your x-ray. They put that vest over you. I'm looking at the other folks doctor, but there's a thyroid guard that goes with it. And I said to them, where's the thyroid guard? And they had to go dig deep to find it.
Wow.
So I said, just in general to all of you, that make sure that when it's not just this covering you, but that it's this covering you as well. And if they have to use two vests,
Yeah, so be it. Yeah.
Yeah, it's called a thyroid collar. So yeah, ask for the thyroid collar. Yep.
Yeah. So thank you. I mean, I'm so sorry I had to dip out, but the information you shared with us was very good. And I think that we can be great patients, and of course, good for our loved ones when we're knowledgeable, and we can be confident to have good conversations with our caretakers, our caregivers, our doctors when we have information. So thank you for arming us with that.
No problem.
Thank you.
Yeah.
Thank you, Nicole. Destiny, you had a question? I think you're muted. We can't hear you though.
Are you gonna hear me?
Yeah, speak up a little bit.
Oh, I just wanted to know, how do you know if you have gingivitis? Because I be feeling like my dentists be abusing me when they floss my gums. Because when I floss them, they don't bleed, but when they floss them, they bleed.
Well, I can't remember this exact statistic, but most people do have gingivitis. That's just what it is. Gingivitis, itis is inflammation of ginger, is the gingival tissue. So inflammation of the gingival tissues, everybody has it. It's just one of those things, and that could be just any puffiness, any redness, any bleeding that comes from not brushing adequately, not flossing is a really big thing. And I'm guilty. I do not like flossing. I'll be the first person to tell you, but it's very necessary because it gets into those little areas that the toothbrush can't get into. So maybe you aren't flossing as well as you could be. Maybe that's why it bleeds a little bit when they do it. Some dentists are just heavy-handed. That's just how it is. But most people do have gingivitis. It's nothing to be ashamed of or embarrassed of. It just is what it is. But it goes away pretty easily once you get those areas cleaned out. But signs of gingivitis is swelling, redness, bleeding.
Nicole?
I have a grandson who's 8, and whenever I see him, I try to clean his teeth well, and I try to encourage him to, brush in the afternoon as well. Mm-hmm. But how can I, and his gums are really, really brown, where his skin tone is a medium skin, it's close to mine, but a little bit deeper. So I kind of, they look just too much of a contrast of a deeper tone. And
So because we're black, there's going to be some. Can you hear me?
Mm-hmm. Yeah, I think we lost Nicole though.
I still see her.
Yeah, I don't know if we can hear her. Okay.
Well, I was going to say,
go ahead, because what?
Yeah, because we're black, we're going to have some pigmentation. It's actually called is it called racial pigmentation? Your gums are going to be darker anyway, a little darker than our European counterparts, just because that's just how we're made. So some darkness is okay. Nicole, you back? Can you hear me?
Can you hear us?
Some darkness is okay. Is the main point I'm trying to make. But if it starts getting puffy and like dark red, almost like a purple, then that's when it's a problem.
Okay. So then I think once we get her back, we can find out if we answered her question. But so is there like a brand of toothpaste that you would recommend then for, just the best toothpaste that's out there? Or
so for that answer, I always say Colgate. And the reason I say Colgate is because In the early during the civil rights movement, they made an ad that targeted black people. They called it Blackie toothpaste or Darky toothpaste or something like that. And then they end up realizing, oh, that was probably racist and not okay. So in the early 2000s, late 1990s, early 2000s, Colgate actually wrote a big old check to Meharry Medical College, which is where I went, apologizing for their ways. So I'm always going to say Colgate because they gave us money. But the real answer is, as long as it has fluoride in it, it's okay. But I'm going to always advocate for Colgate.
Okay.
But yeah, as long as it has fluoride in it and it has that seal of approval from the ADA, meaning it's been tested, then it's okay.
Okay.
Which most of them do.
Go ahead.
Yeah, most of them do
I
have
totally
this.
had to sign out and leave and come back in because everything went silent and I couldn't hear anybody.
Okay.
So basically,
Okay.
did you suggest that Colgate with fluoride or something? What did you say?
Yeah, I said Colgate always just because they gave Meharry a lot of money for being racist, but as long as it has fluoride in it, then it's okay. And it's been approved by the ADA. Yeah, it's okay. But did you hear what I said about his gums? Since he's black, he's gonna have some pigmentation. That's normal.
Right.
So to be dark, for it to be dark is okay, but if it starts like purplish, like really dark red or puffy, then that's when it's a problem.
Okay. Thank you.
So yeah, some pigmentation is definitely gonna be normal.
Okay. So there's some toothpaste. Go ahead. I'm sorry. One. There's some toothpaste that's I can't think of the name of, but it's black. It's like
Is it that
it's
charcoal
not-
toothpaste?
it's like- that's exactly what I'm trying to think of.
Tom's, I think.
Because I use it, but it's kind of, just to rinse it out and stuff. Of course, you got this black stuff coming out. But what do you think about that?
Yeah, that's personal preference. A lot of people are doing it now because a lot of people are scared of fluoride. They think that it's what they say gives people ADHD or something like that. There are no claims that say anything like that. that's just I don't know where that came from. So yeah, I guess it's just personal preference. It's nothing wrong with those at all, but they do not have fluoride. They're organic, I guess, so they don't have those nutrients and those minerals. They help to remineralize that enamel. I will say that a younger person probably needs fluoride a little more than a seasoned saint, just because their teeth are still growing and getting stronger and developing. Not saying fluoride isn't important for you, because it still remineralizes and makes your teeth stronger, but like for kids who don't use fluoride, I try to advocate really heavy to make sure that the parents are giving them some type of supplemental fluoride, because it's just so important. So that's personal. I don't use it because I don't like the grittiness of it, but
Right.
it's nothing.
I mean, that's
necessarily
the
wrong
part
with
I like because I think it's cleaning.
Got you.
that's
Some
the
people
part
like
I
that pumicy, that gritty factor. They feel like it's getting things clean. But you honestly don't want your teeth too clean. You don't want it too streaked, because then it could damage your enamel. So that squeaky clean feeling is good, but you don't want it to strip itself of those nutrients.
But it's a gentle, I do a gentle circling.
Mm-hmm.
Pam, did you have a question? Yeah, unmute you. Okay.
I was trying to unmute. Okay, and just to follow up with the collar for the thyroid thing, do you ask for the collar if you having thyroid issues, or you just ask for it in general?
You can ask for it in general. If you have patient autonomy, you have a right. Can you hear me? Right. You have patient autonomy, so you have a right to ask for that at all times. That's
But
perfect.
do I need it if I don't have any thyroid issues? Do I need it?
Yeah, it's nothing wrong with prevention. There's nothing you can. Yeah, that's fine. You can always ask for it. Yeah.
Okay.
Now I will say that the percentages, like Nicole said, is very low. So you probably won't get anything from it. You honestly get more radiation from your phone and everyday life than you would in the dental office, just because we protect you so much. But there's nothing wrong with extra covering.
That's very
And I was
true.
saying it I was saying it from a standpoint of prevention, that it's not just something like that, but there are various environmental things that affect our bodies overall, our thyroid, like our nutrition and certain bad things that we take in preserve. So it's not just that. That's just one aspect of the me getting back to thyroid health and me learning about it, that I learned about the, covering up, the thyroid. And I thought about all those years as a child through childhood and stuff that it was not necessarily covered up. You know what I mean? The exposure. So it's just one of the things on the checklist to kind of.
Absolutely. And I think, Nicole, you're right. And Nicole actually just brought the awareness to me. It's like when we learn to spray on cologne, what do? Right here in your thyroid. So now because of you, just spray it in the air and allow it to just mist down or whatever. But we were taught to do this. And so I think we should just, learn to do better and protect your vital organs and different things like that. So I think that's very, very helpful. What other questions? This is a great little session. What other questions? Callers on the phone. I have 2 callers. Any questions from you? Are you able to hear us this week?
I can hear you.
Okay, great.
Can you hear me?
Any questions? We can. Any questions? Yeah, any questions?
Actually, I have a question, but it's not regarding the COVID. What's the procedure if you're on blood thinners first going to the dentist?
Very good question. That depends on the procedure you're getting done. If you're getting just a routine cleaning, you're okay. If you're getting a filling, you're most likely okay. The issue runs into when you're getting extractions, but not only just extractions, multiple extractions, or surgical extraction. So if I think, and by surgical, I mean I have to use the drill, I have to cut the tooth out of the socket. So if I think it's going to turn surgical, then I may ask you to discontinue use of blood thinners for a day prior and a day after. But studies are coming out every day that prove that may not necessarily be as necessary as it once was. So it really is up to the dentist's discretion. But if I know that you're on Plavix or something and I'm doing 6 or 7 extractions, I'm probably going to ask you to stop at least a day or so, because the blood clot is so important in the healing process, and you can't properly clot if your blood is just continuously flowing. If it's just one tooth and you're pretty under control, then you should be fine. But it's when it becomes multiple and when it becomes surgical that I start to get just a little bit more cautious on that. And just to protect you, will you bleed out from an extraction? Probably not, but why risk it?
Oh no, okay, all right. Thank you, Dr. Jackson.
You're welcome.
Thank you for asking your question. All right. So anyway, I think we're going to end on time tonight. So if there are no other questions, we want to thank you for joining our Family Communication Exchange. And Jessica, could you give us like a 5-minute summary of tips of the week, something to close us out?
Yeah, so the main thing is it's definitely still safe to go to your dentist office, but there's nothing wrong with calling and saying, hey, what are you guys doing to make sure that me and you are safe? Are you guys requiring a mask? Do you guys have filters? Are you guys doing all procedures? What is your PPE? There's nothing wrong with asking those questions to make sure that you're going to be protected. Some dental offices haven't been doing nearly enough, in my opinion, and you have the right to either request something, or you can always find somewhere else to go. They don't have to do these things, but if that's not making you comfortable, you're allowed to move elsewhere. Wear a mask. That's very important. Wear a mask. Make sure it covers your nose and your mouth. Dental emergencies do not include chipping a tooth. Do not include baby teeth falling out unless you're bleeding profusely, unless you have spontaneous lingering pain. It's like keeping you up at night, swelling, fever. All those things constitute an emergency. Otherwise, then it's called elective care, and that can be postponed for a little while. I would definitely still suggest you go get your cleanings, your regular cleanings, but if you aren't comfortable with that, make sure you're still brushing and flossing every single day to do your part to keep your gums and teeth as healthy as possible. A lot of times people focus only on teeth, not realizing that the gums are just as important, if not more important. The gums are your foundation, and I always say you would not build your house on sand. You would build your house on nice firm concrete. So when your gums aren't healthy and they're bleeding and they're puffy and they're swollen, that's sand, and we can't build nice healthy teeth on that. We have to make sure your gums are healthy. So that includes flossing. There's nothing wrong with a water pick, making sure that everything stays clean for you. Um, and yeah, just stay safe. Wash your hands. Use the Listerine and peroxide mix if you feel the need to have some extra protective care. And just be kind. I've had a lot of patients who um, have been sort of demanding or just kind of rude, maybe expecting us to work miracles because of years of neglect, and that's not fair. So just be kind to everyone, all of your providers. And that's it.
All right. So thank you so much, Dr. Jackson, for sharing with us. This has been a phenomenal session. Just a lot of knowledge, and we do thank you. We'll record this session and post it along with our other sessions. But as I close, we do have a coming up session at the end of the month, uh, homeschooling. We have a family member that's been homeschooling for many years, and they're going to share with us some techniques about homeschooling that's coming up. But I do want to just, in the same vein that Jessica was speaking on, is just be kind, reach out to people. It's just so many things happening in the world today. I just think that we should be kind, be aware, be responsible. It's not always about you. It could be protecting someone else. So I think going out, so, close quarters in these groups, you're not being, especially if you bring it back home to someone else. So I think we should be responsible and reach out, love more, stay aware, stay in touch. And one of my platforms is domestic violence. So please reach out to your friends, check on them, find if they're okay, pick up the phone and ask them if they're okay. So that's it. So this has been our Family Communication Exchange, episode 5, with Dr. Rochelle Jackson. We thank you. Bye for now. See you soon. God bless you.
Thank you.
Thank you so much for joining. Bye for now.